Coronavirus disease 2019, COVID-19, is a contagious respiratory illness caused by a virus called the Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The virus that causes COVID-19 is a new coronavirus that was first identified in Wuhan, China, in December 2019. COVID-19 can be spread from person to person through respiratory droplets produced when an infected person coughs or sneezes. It can also be spread through contact with contaminated surfaces or objects. The most common symptoms of COVID-19 include fever, cough, shortness of breath, fatigue, muscle aches, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Some people may also experience a loss of taste or smell. Most people with COVID-19 recover within a few weeks. However, some people may develop serious complications, such as pneumonia, acute respiratory distress syndrome, multisystem inflammatory syndrome in children, and death. Prevention. The best way to prevent COVID-19 is to get vaccinated and boosted. COVID-19 vaccines are safe and effective at preventing serious illness, hospitalization, and death from COVID-19. Other ways to prevent COVID-19 include 1. Wearing a mask in public indoor settings and on public transportation. 2. Washing your hands often with soap and water. 3. Avoiding close contact with people who are sick. 4. Covering your mouth and nose when you cough or sneeze. 5. Cleaning and disinfecting frequently touched surfaces. Treatment. There is no cure for COVID-19, but there are treatments available to help relieve symptoms and manage the virus. Treatment options may include 1. Over-the-counter medications to relieve fever, cough, and aches and pains. 2. Prescription medications to help reduce the severity of the illness and prevent complications. 3. Hospitalization for people who need supportive care, such as oxygen or mechanical ventilation. Who is at risk? Everyone is at risk of getting COVID-19, but some people are at higher risk of developing serious complications. People who are at higher risk include 1. Older adults. 2. People with underlying medical conditions, such as heart disease, lung disease, diabetes, or cancer. 3. People who are immunocompromised. 4. Pregnant women. What to do if you think you have COVID-19? If you think you have COVID-19, get tested as soon as possible. You can find a testing site near you at the U.S. Centers for Disease Control and Prevention, CDC, website. If you test positive for COVID-19, isolate yourself from others and monitor your symptoms. If you develop any serious symptoms, such as difficulty breathing or chest pain, seek medical attention immediately. COVID-19 and the global pandemic. The COVID-19 pandemic has had a devastating impact on the world. As of August 4, 2023, there have been over 592 million confirmed cases of COVID-19 and over 6.4 million deaths reported worldwide. The pandemic has caused widespread economic disruption and social unrest. It has also strained healthcare systems and disrupted education and other essential services. The future of COVID-19. It is unclear how long the COVID-19 pandemic will last. However, scientists are working hard to develop new vaccines and treatments for the virus. In the meantime, it is important to continue to take steps to protect yourself and your loved ones from COVID-19. This includes getting vaccinated and boosted, wearing a mask in public indoor settings and on public transportation, and washing your hands often with soap and water. COVID-19 is a serious illness that can have devastating consequences. However, there are steps you can take to protect yourself and your loved ones from the virus. Get vaccinated and boosted, wear a mask in public indoor settings and on public transportation, and wash your hands often with soap and water. If you think you have COVID-19, get tested as soon as possible and isolate yourself from others.